Dr. Crayle, we did talk about missing teeth and how they perhaps can affect, the whole posture of the person, can affect his well-being in terms of headaches. Never mind that he could lose more teeth because they start shifting and start looking a little bit like a fence which is out of alignment. But in any case, how do we replace them? What options do we have? What improvements have there been made over the last, years in terms of replacing those missing teeth?
Okay. Teeth can be replaced in a number of ways. There can be a bridge work, which a bridge is something that connects between two existing teeth to put a missing tooth in the middle. There's also partial dentures, which are generally removable, and they can replace any combination of missing teeth or even all the teeth if the person has no teeth. And then there's also something called implants, which can be used. They're more recent, but they work very well, and they're very much like natural teeth. Whereas an artificial root is implanted in the jaw, and then a tooth can be like a crown or a bridge can be placed on top of that, restoring the person to normal appearance and function.
When you say an artificial root, you mean basically a metal screw is going to put in his jaw, right?
It's similar to that, yes.
It's titanium, right? It's the same material that they use for hip replacement.
Yes, very similar.
Yeah. So tell us a little bit about, let's for a moment forget the partial, because most people obviously look for something much more beautiful, permanent, and more functional. A partial, it's maybe something, if it happens and you need to replace it for tonight because you have a wedding going on or whatever. But anyway, let's look at the crown, or the bridge, which is, two teeth, and something hangs down from the middle, which is another tooth, or the implant. Give us some of the pros and cons, or if there are no pros and cons, tell us a little bit when one is more applicable than the other one, what patients should know about each one of them.
Okay. One advantage of the bridge is that the bridge can usually be done in 2 visits about 2 weeks apart. And so it's relatively quicker and easier, and tends to be a little more economical as well. The implant takes a little bit longer to do. There's a healing period in the middle, so it may take a couple of months or more for that whole process to take place. On the other hand, the advantage there is that it does not have to involve the teeth next to the gap as anchor teeth. It can just involve the one space where the tooth is missing.
Okay. Now, all right. So, what is now? If a person has an implant and it's like 6 or so months, so you put first the metal screw in it, and then it takes about 6 months before the tooth can go on. During those 6 months, does the person have to run around with a hole in the mouth and a metal screw sticking out, because that looks ugly, or does he get some type of temporary and looks relatively okay, just not as functionable?
Right. There are different kind of temporaries that can be made. Plastic temporary that looks and functions very much like a tooth. Yes.
Okay. So he's not totally out of, looking ugly for 6 months.
No.
All right.
No.
Now, tell me. So you said, you need to be with a bridge. You need to be, obviously, you have that hole in there, so that next to the tooth, they like a bridge, they're used as an anchor. And you said they have to be attached or so. Tell us a little bit about why is, basically they need to be grinded down so that you can put your cap or your crown on it, where the other tooth hangs down. But why is that a negative thing?
Oh, it's not necessarily negative. Sometimes the tooth next to the gap actually needs a crown or may already have a crown on it. So that's fine. But if the tooth is a perfect tooth and the patient doesn't want to involve that tooth, then the implant or perhaps a partial would be the better option.
Okay. And from a clinical viewpoint, from a dental viewpoint, what would you say? Let's say the teeth next to it are healthy. Is there a reason why you want to avoid grinding them down and put a crown on it?
Sometimes yes and sometimes no. It depends on what area of the mouth it is and perhaps how the person bites in that particular area, how they want to maintain their mouths, and maybe it may be a matter of economics or what they can afford to do. So we work with the person considering many factors of what their desires and abilities are, what we can offer to them to try and get the optimum solution for each individual.
And when it comes to, in terms of longevity, in terms of lasting, does an implant last longer than a crown or a bridge or not?
Well, we like to say that these things can last indefinitely. Of course, sometimes problems can occur, but if you maintain them, they can last for many, many years and do very well.
When you say the implant and the bridge, both of them?
Yes. That's correct. We have studies that show implants can last for 10, 20 years. It's true that there can be problems with them, but like I say, maintenance is the key. You need to see the dentist regularly, and if there's any problems that occur, we need to catch them early. Sometimes, rarely, but sometimes it can occur that the patient's body is not able to accept that implant, or there may be some kind of infection that occurs. So we want to get on it right away to try and preserve that work that's been done.
Mm-hmm. And what about the crown? The bridge. What's is that also 10, 20 years? And again, that's not a real number as such, but it's, a good decent average number. Is it the same or is it a little lower or what's the deal there?
It's similar. If the person does well with it, in terms of maintaining their hygiene and regular dental visits and, no unusual accidents would occur, then it can be maintained for many years. Now, if the person has a lot of sugar in their diet, if they're drinking a lot of sweet tea and soda, and they have a lot of decay, if they don't maintain good hygiene, things can occur to undermine the stability and the health of those teeth that support the bridge, and then there could be problems.
And I heard that, when you have a bridge, you have basically, let's say, 3 teeth minimum. It could be 4 or whatever. And they're more or less welded together. So you can't really go with your dental floss in between, which means you have to go underneath. And
Correct.
Not that is a huge problem apparently, but for guys who are a little bit on the lazy side, let's say like me, my wife, when she goes brushing teeth, she still brushes when I have done the showering, the brushing, the shaving, and she's still brushing. So very obviously she does a better job than I do. So if a person's dental hygiene isn't good, is it easier to neglect the bridge because it's a little more difficult to work, and then by doing so create a gum disease, which in itself, in other videos you have mentioned how bad that is, but at the same time it might make your bridge failing a little easier because you get it rotten,
Well, we work with the patients to make sure that they have a way that they can get in there to clean that's comfortable for them. The toothbrush can do only so much. It's somewhat limited, especially with going in between the teeth. So for that, we have the floss, or there's little picks and brushes and other things that can get in between. So we work with each patient to get something that they can use to maintain that healthy gum and tooth in there.
But some extra effort when you have a bridge compared to normal teeth or implants is needed. A little bit of extra oomph to make sure it doesn't, you clean it is needed.
It's a little bit, but not a big hassle.
Okay. Well, all right. Thank you very much. Here you have it again. Lots of information, and basically, so it looks like there's not really that big of yes, implants are there. They're a new thing. They're probably convenient in many areas, but it's not that they have totally replaced a bridge. Bridges still, just like 10, 15 years ago, have their huge workability, are there and serve their purpose like an implant would.
Certainly, there's a market for bridges and implants and partials, and that will continue. People have options, and that's good.
That is good. Thank you very much, Dr. Crayle.